Hi all, Doula Rose here with Heart&Home Doula Services, and today we're going to talk about informed consent. Now, informed consent is defined as permission granted in the knowledge of the possible consequences, typically that which is given by a patient to a doctor for treatment with full knowledge of the possible risks and benefits. Informed consent is your right as a patient, but it's also your obligation to ensure that you receive it. Please note that it says full knowledge of the possible risks and benefits, ladies. So if your super awesome OB wants to give you a Pitocin drip 4 hours into labor, then you should be asking why. If they manage to give you a valid reason for it, then you need to use your BRAIN acronym. Some people add an S at the end for smile. I say if you don't want to smile, you don't have to. BRAIN for what are the benefits of the procedure? What are the risks to mom and baby for R, okay? What, if any, are the alternatives? And after hearing all that, I really want you to think about what your instincts are telling you, because my spidey senses are tingling. No, okay, I'm not kidding. And more often than not, for the N, you can do nothing.
The power of nothing.
Okay, more often than moms realize that is a valid option. Without informed consent, it is not possible to make informed choices about your care. Now, ladies, I recommend using your super awesome typing skills to look up a childbirth class near you. I want you to call and I want you to ask them if they have any classes on informed consent to better equip you on your path to labor, informed and fearless. There are 3 awesome ways that a childbirth educator can help you reach your labor goals, okay? They are bringing awareness to what all of the possible interventions you're likely to face during labor are ahead of time and why they might be needed. They can help you be more difficult to manipulate. And lastly, they can help you feel empowered and confident in your choices that you make. Remember that a childbirth educator must be an educator first. Okay, and while many childbirth educators are in fact doulas, the role is slightly different in a very key way. A doula has got your back, okay? Thick and thin, they're gonna help you labor how you wanna labor in any and all ways, supporting your choices and your preferences during labor. A childbirth educator is more informing you on what exactly those choices look like and what they might mean. A childbirth educator is first and foremost passing along knowledge that is evidence-based and up-to-date. You need to look for that. This doesn't reflect the mother's preferences during labor in any way.
So don't take it personal.
Okay? It's a far more neutral standpoint. A doula might try and steer clear of discussing the risks of specific medications, even if they are public knowledge, but a doula's desire is to make sure that the client doesn't feel shamed or uncomfortable. They want that to be the most positive thing possible. Well, for a childbirth educator, educating them on what these options look like and the benefits and risks on those is ensuring the best possible outcome for them so that they can make these decisions with their labor. They need to give the information necessary to ensure that their students are well educated on the pertinent risks and benefits. With that said, I am both a doula and a childbirth educator, and so it is absolutely possible and quite easy to do both jobs and wear both hats. I hope that this video was helpful, and I hope you guys enjoyed it. Please click the subscribe button if you want more material like this, and Doula Rose says ciao.